name is Hannah. I'm a student nurse. I'll be doing a head-to-toe assessment on you today. Before I get started, I'm going to wash my hands. Can you tell me your name,
Catherine,
where you are,
your house,
and today's date?
Tuesday.
Patient is alert and oriented ×3. Are you experiencing any pain on a scale of 0 to 10, 10 being the worst?
0.
Patient denies any pain. I'm going to inspect your scalp. Hair is evenly distributed, no signs of hair loss, no signs of lumps or lesions. I'm going to inspect your ears. Ears are symmetrical. I'm going to inspect for any drainage. No signs of drainage. I'm going to inspect your face. Face is smooth, no signs of rash or lesions, and it's correct for ethnicity. I'm going to inspect your eyebrows. Eyebrows are evenly distributed, no signs of hair loss. I'm going to inspect your eyelashes. Eyelashes are evenly distributed, no signs of hair loss. I'm going to inspect your eyelids. Eyelids show no signs of ptosis. I'm going to inspect your conjunctiva. Conjunctiva is pink and moist, no signs of drainage. I'm going to inspect your sclera. Sclera is white and moist and no signs of jaundice. I'm going to inspect for your corneal reflex. Corneal reflex is present. I'm going to inspect your pupils. Pupils are reacted towards light, and can you follow my pen light? Pupils are equal, round, reacted to light, and accommodate. I'm going to inspect your nose. Nose is symmetrical. Can you tilt your head back? No signs of drainage. I'm going to inspect your lips. Lips are pink, moist, no signs of cracking. Can you smile? Puff out your cheeks. Frown. Cranial nerve 7, facial nerve is intact. I'm going to inspect inside your mouth. Can you open your mouth? Buccal mucosa is pink and moist. Teeth show no signs of caries, and gums show no signs of gingivitis. Can you stick out your tongue? Cranial nerve 12, hypoglossal nerve is intact. Tongue shows no signs of white patches and is pink and moist. Can you say ah? Cranial nerve 9 and 10, glossopharyngeal and vagus nerve are intact. Hard and soft palate are pink and moist and intact, and tonsils are not present. I'm going to inspect your neck. Neck shows no signs of lesions. I'm going to palpate for any mass or lumps. No signs of mass. I'm going to palpate for your carotid pulse. Carotid pulse is present and +2 strength. I'm going to assess your skin turgor. Skin turgor is elastic and shows no signs of dehydration. I'm going to palpate your body temperature. Body temperature is warm and equal bilateral. I'm going to inspect your respirations. Respirations show no signs of labored breathing. I'm going to listen to your breath sounds, and each time I move my stethoscope, can you take a deep breath with your mouth open? Deep breath. Deep breath. Deep breath. Deep breath. Breath sounds show no signs of crackles or wheezes. I'm going to palpate for your apical pulse. Apical pulse is on your left side, 5th intercostal space, mid-clavicular. Apical pulse is palpable. I'm going to auscultate your apical pulse for a full minute. Apical pulse is normal rhythm. I'm going to auscultate your heart sounds using my diaphragm first, starting at the aortic valve. Aortic valve is between your second and third intercostal space on your right side. Pulmonic valve is on your left side between your second and third intercostal space. Tricuspid valve, which is on your left side between your fifth and sixth intercostal space. And mitral valve, which is on your left side between your fifth intercostal space clavicular. I'm going to auscultate those same heart sounds, but this time using my bell. Aortic, pulmonic, tricuspid, and mitral. Heart sounds show no signs of gallops or murmurs. I'm going to inspect your abdomen. Abdomen is flat and smooth, no signs of lesions or rash. I'm going to auscultate your bowel sounds starting at your right lower quadrant. Right lower, right upper, left upper, and left lower. Bowel sounds are active in all four quadrants. I'm going to palpate your abdomen. If you're experiencing any pain, can you let me know?
Okay.
Light, deep, any pain?
No.
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 Patient denies any pain and there's no signs of mass. I'm going to inspect your upper extremities. Upper extremities are smooth, no signs of lesions or rash, and joints are symmetrical. I'm going to palpate for your upper extremity temperature. Upper extremity temperature is warm, equibilateral. I'm going to assess for your strength and your grip. Can you put both arms up and push against my hands? And squeeze my fingers. Strength and grip are both present and are equibilateral. I'm going to palpate for your radial pulse. Radial pulse is present +2 strength. I'm going to assess for your capillary refill. Capillary refill is rapid and less than 3 seconds. I'm going to inspect your lower extremities. Lower extremities are smooth, no signs of lesions or rash. Joints are symmetrical. I'm going to palpate your lower extremity temperature. Lower extremity temperature is warm and equibilateral. I'm going to assess for your strength and flexion. Can you push your legs against my hands? And flex your right foot and your left. Strength and flexion are both present and equibilateral. I'm going to palpate for any pretibial edema. No signs of pretibial edema or indentation. I'm going to palpate for your posterior tibial pulse. Posterior tibial pulse is present +2 strength. I'm going to palpate for your dorsalis pedis pulse. Dorsalis pedis pulse is present +2 strength. And I'm going to assess for your capillary refill on your great big toe. Capillary refill is rapid, less than 3 seconds. Do you have any questions?
No.
Thank you for coming in.